What is HER2-negative invasive lobular carcinoma, ILC? HER2-negative invasive lobular carcinoma is a specific type of breast cancer that begins in the lobules, which are the milk-producing glands of the breast. This cancer is characterized by the absence or low levels of the HER2 protein, which is known to promote cancer cell growth. In HER2-negative cancers, this protein is not overexpressed, meaning it does not play a role in the growth of these tumors. Invasive lobular carcinoma is the second most common form of invasive breast cancer, making up about 10 to 15% of all breast cancer cases. Unlike invasive ductal carcinoma, which forms distinct lumps, ILC cells tend to grow in a single cell pattern. This unique growth style allows them to spread more diffusely through the breast tissue, which can make them harder to detect through physical exams or imaging techniques. Most tumors of invasive lobular carcinoma are hormone receptor positive. This means they often express estrogen receptors and/or progesterone receptors. In fact, around 95% of ILC cases are estrogen receptor positive, and 60 to 70% are both estrogen and progesterone receptor positive. However, since they do not overexpress HER2, they are classified as HER2-negative. This hormonal profile is significant because HER2-negative ILC often responds well to hormone therapies that either block estrogen's effects or reduce its production. Because HER2-negative ILC lacks the HER2 protein, it does not benefit from targeted therapies like trastuzumab, which are effective for HER2-positive breast cancers. Instead, treatment for HER2-negative ILC typically includes hormone therapy, surgery, radiation, and sometimes chemotherapy, depending on the stage of the cancer and other individual factors. Clinically, HER2-negative ILC may present with subtle symptoms. Patients might notice breast thickening or firmness rather than a clear lump. Other signs can include changes in breast size or shape, skin dimpling or puckering, nipple inversion, or discharge. Due to its diffuse growth pattern and subtle symptoms, ILC is often diagnosed at a later stage compared to other types of breast cancer. Several risk factors are associated with invasive lobular carcinoma. Lifetime exposure to estrogen plays a significant role, influenced by factors such as hormone replacement therapy, reproductive history, and alcohol consumption. This type of cancer is more commonly found in postmenopausal women and is quite rare in men. In summary, HER2-negative invasive lobular carcinoma is a form of breast cancer that arises from the lobules, characterized by hormone receptor positivity and a lack of HER2 overexpression. Its diffuse growth pattern can make detection and diagnosis more challenging, and treatment primarily focuses on hormone-based therapies rather than HER2-targeted options. Early detection and appropriate treatment are crucial for improving patient outcomes. Always consult healthcare professionals for personalized medical advice and guidance.